one statement. It's interesting you bring up the fact about the grassroots. Before I left the house, I was watching CNN, and his statement was that he definitely felt as though Obama should stop campaigning. Campaign's over, and this grassroots stuff won't work. So it's interesting for us to be talking about, yes, it will work. They should have learned a lesson. Yeah, right. Are you crazy? They don't understand the power of people.
Choice, affordability, and quality care. Do you think health care is like an important piece? I think we wouldn't be here if we didn't. I know. I feel that's why this particular event was filled to capacity.
Hi, my name's Claudia Strauss from Claremont. I teach at the Claremont colleges, but it just seems like a moral issue to me that everybody should have access, and that's why I'm here. And it's something I actually teach about and write about how people think about this issue, and whatever I can do to help them.
Oh, thank you. You write about it?
Yeah.
Oh, that's good to know because I like to see some of your thought patterns. Thank you for being here.
I can tell you what thought
Okay. You might be in trouble.
I'm a retired professor from the Claremont colleges. My name is Jill Benton. In my extended family, as I assume all of the student people who are not covered by insurance, all we have to do is break a leg, and they're destroyed.
My name is Betsy Desimone. I'm a healthcare management consultant. I have clinical training in medical social work.
Hi, Ellison.
So, kind of starting a stint as a student lobbyist. So I mostly work with educational issues, but healthcare is another concern of mine. And I've seen the power of grassroots organized interest, and it definitely can cause major changes.
I'm Sandy Romero-Boada from Pandora.
I'm Marlene Ashley, resident of San Dimas.
Wow.
I'm retired from BP Oil.
Juliana Dabney Dorsch. I'm a resident of San Dimas.
My name is Robert Stewart.
Another?
Yeah, for Robert. I'm a respiratory therapist.
My name is Joseph Chidi. I live here in Laverne. I have a PhD in public administration, master's in international relations, but I'm a registered nurse.
Hi, my name is Barbara Walker, and I'm from Walnut, California.
My name is Belgie, and I'm actually he's my nephew, and he was telling me about it. So I'm basically here to support, the community, to deal with that, anything that they can help with.
My name is Brian, and the reason I'm here is just kind of to see what we can do on a community level, just like we said.
And my name is Tracy Mosbey. Do anybody have any questions from her?
When I go to myBarackObama.com and I get the information about the 27, could we put that on just a flyer paper, print it off, and then hand it out at grocery stores and get the word out or
I'm Lynette. This is Joshua. We live in Canada.
How about you?
I'm John.
Hi, John.
I'm with her. This is my son Peter.
My name is Linda Stelsreed. I live in Covina.
My name is Dale Coleman. I'm from Covina. I work in Pomona at the Urban League Workforce Center.
Hi, I'm Sandy Lee. I'm Canadian American. So I have seen the other side of it, socialized medicine. Unfortunately, they're kind of, I think, spoiled now, and there's a lot of complaining about it in Canada now.
Oh, really?
But they don't know how good they have it.
First, since I've graduated school, I've had to navigate the waters of the individual insurance market quite a bit because I have not had the same job for the past couple years, and so as a result, that just sort of led me to believe that the current system is very broken, especially for people who come off their parents' health insurance once they are no longer full-time students. I think that's one particular area that's very, very broken, and it's unfortunate because I feel like it would be very cheap to cover healthy young people.
I'm Linda Stewart with him.
Okay, thanks.
I'm a retired nurse, and over the years I've seen really the damage that insurance has done to patient care.
Listen to the message from the president and address all the concerns. Okay? Thank you, guys. sharing your story so far. Think about your
Coming weeks and months, Congress will be engaged in the difficult issue of how best to reform health care in America. I'm committed to building a transparent process where all views are welcome, but I'm also committed to ensuring that whatever plan we design upholds three basic principles. First, the rising costs of health care must be brought down. Second, Americans must have the freedom to keep whatever doctor and health care plan they have, or to choose a new doctor or health care plan if they want it. And third, all Americans must have quality, affordable health care. These are principles that I expect to see upheld at any comprehensive health care reform bill that's sent to my desk. I mentioned it to the groups that were here today. It's reform that is an imperative for America's economic future and reform that is a pillar of the new foundation we seek to build for our economy.
This time, we'll counter the lies and the distortions with facts and with the real stories of people who can't afford to wait one more day for things to change. It starts today, it starts here, and it starts with you. So thanks again for coming to this healthcare organizing kickoff and for everything you've done and will continue to do to change this country.
I'm Eunice Russell. I am a resident of Pomona. I am a business person, entrepreneur, and
Miriam Magley. I'm also self-employed.
Hi, I'm Desiree Morales. I live in Pomona.
Have a referral for people. I think, there are some free clinics, and I maybe that's the issue that we're talking about is some of the free clinics.
That's where I'm at. And I'm here because I'm concerned. And I have 3 sons here, still in college.
I'm going to show you how to use our neighbor to neighbor tool through our group. Looking forward to working